paramedics in Montreal and Laval are now responding to nearly 3 opioid overdoses a day that require naloxone, triple the rate from 5 years ago. That's according to La Presse, which reports the crisis is being driven by increasingly contaminated drugs. While more bystanders are stepping in with naloxone before help arrives, health officials say overdoses are becoming harder to treat. Let's find out a little bit more on this. Catherine Boucher-Rodriguez is a professional coordinator with the overdose control team at Laval Public Health. Catherine, welcome to the program.
Hi, thank you for having me.
So, Catherine, just how bad is it right now?
Well, I think that it's important to say that for Laval, our situation is specific and not necessarily the same as Montreal. So we're seeing a number of that is stable between 2023 and 24. So we've recorded 15 deaths. And we're seeing a combination of factors. Yes, the drug supply has become increasingly unpredictable, especially with fentanyl and its analogs and other counterfeit substances that are even more dangerous and potent. And at the same time, what we see is that most deaths happen when people are alone at home.
And what about, so the deaths have stayed stable? Are you getting more calls though? Or because I'm seeing that paramedics are responding to far more calls.
Yes, we are getting calls from paramedics, but it's important to say too that paramedics, they report us the calls on which they administer naloxone. And in Laval, a lot of people who use drugs are using stimulants. So naloxone is not necessarily administered, but doesn't mean that it's not an overdose, and it doesn't mean that the person doesn't have to be brought to the hospital to be, example, reanimated, or they necessitate emergency services. So
you're saying the deaths have not gone up year over year? But what you know, there obviously is concern. So what is driving your concern?
Well, what is driving our concern is that we need to get the message out there, prevention message out there. So we need people to carry naloxone with them. We need people to not use drugs alone. So that's where overdose happen when the person is alone, because they can't administer naloxone to themselves. They need someone else to do it for them. And we also want people to use the harm reduction services like the overdose prevention site that we have in Laval.
So can I ask you, when you say people like should be carrying naloxone, what people are we talking about here? Because, you know, I've never touched this stuff in my life. I'm not carrying this. So who should be carrying this when you say people?
I say people, talking about everyone. Naloxone should be in a first aid kit, as is EpiPen.
Okay, so so if I'm carrying a first aid kit, if I'm someone that's got a first aid kit, I should be including this.
Yes, sure. That's what we would like, because that would be reducing the stigma for people who use drugs, because it can be your neighbor, it can be anyone nowadays. So it's not only people who are living on the street. So that's why we need to have naloxone in a first aid kit, and we need to be able to use it. And that's very simple. The Institut National de Santé Publique has done a short video, so that's a 3-minute video to explain how to recognize the symptoms of an opioid overdose and how to administer naloxone. So it's just a nasal spray. Very easy to do, and it's important to say that there is no consequences. The person is not doing an opioid overdose. It won't have an effect on the person. So it's very safe to use.
So I respectfully, I ask this, right? In other parts of the country where the situation with opioid overdoses got far worse, far quicker, right? Like British Columbia. They've done these types of things. It has not led to better outcomes. Like deaths have gotten worse. Now they reached such a plateau in BC. There's been a plateau effect where it's leveled out in British Columbia. But they tried many of these things, and it didn't necessarily have the positive effects that they were looking for. Do you have an idea as to why that is?
Well, I don't know for BC, but I know for Quebec, we have been putting measures in place for many years, and we saw the crisis coming. So we put preventive measure in place, and we had injection sites in Montreal very early on. Naloxone became free before the crisis took off. So I think we have a good strategy in place to prevent the crisis from getting worse.
In BC, it's the number one cause of death, 18 to 35-year-olds, number one cause of death, opioid overdoses. Are you concerned that we could end up in a situation like that here where, for young people, 18 to 35, this could become a crisis situation?
Of course we are, and we're doing our best in our region to prevent that from happening. So that's why we are putting the message out there towards young people. We did a campaign at the end of the school year this year to try to reach young people and have them be to carry naloxone and to adopt prevention behaviors.
So let me ask,
if using drugs. Now,
part of this issue here is that the drugs that are being sold on the street, they're becoming more dangerous. They're more contaminated. It's the quote unquote quality of these drugs that is part of this issue.
Mm-hmm. Yes. Well, the quality. People are buying what they think is an oxycodone, but in fact, it's a counterfeit one containing maybe fentanyl or maybe another type of opioid that is even more potent. So they're not working with the dosage that they should be. And they also have other substances in there, like benzodiazepines, which cannot be reversed with naloxone. So that's important to say that even if naloxone is given, the most important part is calling 911 because we don't know if it will work for this person to save her. Also, yeah.
No, go ahead. Finish your thought.
Well, I think the substances are unpredictable. So people don't know what they get when they buy something either from the web or from their pusher. They don't know what is in the substance.
I have a note from a listener. They're listening to us and they send us a text message into our text message line. And they're wondering if they could end up in trouble, being sued or, some sort of criminal trouble if they were to give a naloxone. They gave this overdose medication and then the person dies. They're worried that if they try and help, they might be held responsible. What do you say to that? If someone tries to help but things don't go the right way?
I'm not too familiar with the law, but I would say that there's the Good Samaritan Act. So no one can be prosecuted for administering naloxone to someone if they have drugs on them. Also, there's no harm in giving naloxone, as I said. Mm-hmm. And also, if they call 911, they're doing the best they can. So no one can punish you for that.
Would you be a proponent of more safe supply sites and also supervised consumption sites?
Well, here at the Public Health Department, we developed in collaboration with a community organization an overdose prevention site, so a supervised consumption site. We have a mobile site going around the city, and people can get their drugs tested. They can inject drugs safely, and they can also inhale drugs, so they can smoke drugs.
Now, do you have an example? Do you have an example from anywhere in Canada where that strategy and those type of sites have worked?
Well, I think they do here because we see that deaths have stayed lower than they do in other provinces where the services are not as developed as they are here.
Gotcha. Okay, Catherine, listen, I have to leave it there. I want to thank you so much for coming on.
Thank you for having me.
That's Catherine Boucher-Rodriguez, a professional coordinator with the Overdose Control Team at Laval Public Health.